Hi, I'm Mahesh Menon.
Hi, I'm Smriti Khanna.
Smriti, today's topic is on home based palliative care.
Okay.
So, now for those of us who are listening to this, what do you mean by home care in palliative care?
Palliative care is given in a lot of settings to a lot of people. Initially, it was mainly patients with cancer, but now we also think about palliative care in the terms of other non-cancer diseases or diseases that go on for a long period of time. Patients who have stroke, patients who are bedridden, patients who have organ failure or organ damage. So, home based palliative care is how we can manage these patients at home. It is part of the overall care that they will get. So a patient can still be going to the hospital for his follow-up visits or once in a while and still receiving home palliative care. And that can be things like how to take care of a bedridden patient. It can be things like how to manage symptoms at home. If a new crisis comes up, how to manage that at home, what medicines to give, what nursing care to give. All this is part of home care in palliative care.
So, what are the advantages of doing home care for anyone who has a disease like you mentioned?
Usually, we do palliative care for people who have chronic illnesses.
Correct.
By this, I mean it's not an illness that's going to go away in a few days or a few months. This is an illness which is going to last with them for many months or many years. People with chronic diseases also have a high symptom burden, which means that a lot of problems keep cropping up. There can be pain, there can be nausea, there can be vomiting, they can have wounds or ulcers, and they can also have repeated crisis. Okay for a few days and then suddenly a new problem comes up. Usually, what we do in these cases, we tend to rush the patient to the hospital.
Correct.
But home palliative care focuses on trying to manage a lot of these issues at home only because these are predictable. These can be managed with medicines which can be given at home only, with medical care that can be given at home only, and it reduces a lot the financial burden of the patient and even other burdens like having to keep going to hospital and coming back and fro. So traveling also.
So, I think in terms of convenience, in terms of financial benefits, it's a great option. What are the disadvantages of a long term hospital stay?
Hospitals are actually made for treating acute conditions, that is conditions which can last a few days, maybe a few weeks or less. When it comes to managing conditions beyond that period of time, a lot of issues crop up. Hospital is a hotbed of infections. The kind of bugs or infections that you see in the hospital are much more dangerous than you see in the community. So the longer a patient spends in hospital, the more likely or more sensitive they are to acquiring new infections. A lot of research has shown actually that patients do well, recover well in their own environment, in an environment that they are familiar with. So this could be their home, trying to get back or rehabilitate into their workplace. And that's why it's also important for them to get out of hospital.
Correct. So, and we are talking about this in the context of palliative care.
Palliative care. Things like issues or problems that will require long term care, like an ulcer or a bed sore. Patients sometimes or families sometimes feel it's better to stay in hospital till it gets completely better or improved. But you are forgetting that a lot of other things will impact the healing of that ulcer. This can be nutrition, this can be how much he is mobilizing, going up and about, what his actual mood is like, how prone he is to catching infections. And so all these things are something that staying in a hospital can actually hamper in the long term.
So, in a nutshell, while the hospital is a fantastic place for healing and managing treatable, curable diseases, when it comes to palliative care, sometimes in long term stay, the risks outweigh the benefits. Like you have infections and other
When
things.
it comes to palliative care and even when it comes to chronic illnesses, I would say.
Chronic illnesses. This brings us to the next question. What are the things that can be done at home? We say that home care, but what are the scope of services when it comes to home care?
So things that we can do at home is symptom management. If there is increase in the intensity of pain or any other problem that the patient is facing, we can try and increase the medicines for it. We can help them with medicines for it. Basic medical and nursing care can all be done at home.
Correct.
So, taking care of somebody who's bedridden. This can include everything from changing catheters, changing feeding tubes, focusing on their nutrition, taking care of their bed sores, avoiding bed sores. All these things can be done at home. Even care for small infections, say, which will require things like only oral antibiotics. These all can be done at home. A lot of patient care is done by the caregiver. Those things are obviously much better done at home.
At home. And what are the limitations at home? What all can we not do at home, at least in the context of Mumbai, let us say, and in palliative care?
I would say that very intensive monitoring and treatment we will not be able to do at home. Things like an ICU environment, it's very difficult to replicate
yeah.
at home. I know that we try a lot to replicate those kind of environments, and there are systems out there which do that, but you cannot fully replicate an entire ICU setup at home. Very difficult for patients to be on ventilator at home. There are only a few on ventilated patients who manage well at home. And I think that if we are looking at trying to treat illnesses which are actually fully curable, those things are not better managed at home. For those things, we need like the more impeccable monitoring and treatment, and clock by clock, hour by hour kind of management that gets done in the hospital only.
So, this is in addition to the question that I asked you earlier. What are the emotional benefits when we do home care? I'm not talking of the palliative care patient alone. I'm talking about the person who's receiving palliative care, about the family. What are the emotional benefits to that unit?
Convenience is a great thing. When a patient is sick, it means somebody else from the family takes him to the hospital. If the travel will take a long time, even if the hospital is nearby, but a hospital visit invariably involves a few hours. So convenience is a great thing. This then kind of boils down to the patient and the family feeling that this illness is manageable. So that is the confidence that they get. That is the emotional and the psychological benefit. Financial support, financial also. If you try and manage a lot of the things at home, at least the ones that can be managed, then the cost of hospital visits go down, and that also plays a big role, especially when we are looking at patient funded care. The other emotional benefits of home care is that patients with long-term illnesses or chronic illnesses find it very demoralizing to keep having to go to hospital. And if they are able to take care of themselves at home, the environment is much more familiar. This is something that they will feel much more comfortable in.
Yeah, so the comfort level increases.
Comfort level. They say this thing that in elderly patients, once they fall sick and they go to the hospital, they suddenly become so disoriented because things are not the way that they are used to. They don't know if it's day or night. They can't see their people around, the ones that they are used to doing it. And so many times I've heard this is as soon as they come back home, they almost get 50% better immediately.
Correct.
And having an environment around you which is familiar, having a good routine, a routine that you are comfortable with over the years, and having familiar sights, sounds around you, all this helps. Now, all this is in the context of diseases that can be managed at home.
So we've covered most of the nuances of home care, and just another question off the top of my head. What do you see the future of the home care space in our city?
We are actually quite fortunate living in Mumbai to have home care that can be accessed by most people. We have different models of home care out there. So if there are families who cannot afford doctor visits or hospital visits, we have models for that. We have NGOs providing good quality home-based palliative care. We have paid models where doctors will be able to come when you want, during emergencies, different specialities of doctors. We have nursing which is available. Good quality nurses will be able to come and take care of you. We also have nurse aides and caretakers who are able to a lot of the caretakers that I see have actually taken care of their patients for months and years, and they are also a part of the family for that family. So I think that the present is good. The future is even better, because I can see that a lot of these organizations are trying to build on what they already have. So trying to improve their quality, trying to increase the number of people, because we always have people in need of home care in Mumbai.
So you need more personnel coming in.
More personnel coming in, trying to make it more accessible to the people that need it.
So that's a very positive note that we'll conclude. Thanks
Thank
for this
you.
wonderful
Thank
insight.
you.